In this section, we're going to talk about teamwork. Let's take a moment, if we can, to consider the many achievements of the Scottish national football team. Although in second thoughts, perhaps not. So what makes an effective team? Well, relying on one superstar to get the job done doesn't work. Need I say more? There's a bit more to it than that. If you want your team to function like a well-oiled machine, you're going to have to work with each other, for each other. Let's take a look at some of the principles.
First up, you've got to have a clear purpose, an action plan. Everyone must have a clear and concise description of what is expected of them. And if you're in any doubt, you must bring your concerns to the attention of others. It only takes one cog in the machine to be turning the wrong way to cause a breakdown. Elect a member of the crew to act as a training coordinator, if you have not already done so. Next, informality. Everybody must be comfortable with the role expected of them, and also with each other. Respect and trust will produce better results. Tension amongst team members doesn't make for good performance. Be honest with yourself and others. Participation. Take an active role in improving the team. Your input is just as important as others. Discuss issues and take part in training exercises. Don't look for excuses to remove yourself from responsibility. Training should be a case of having pride in what you do and improving the professionalism of the team. Remember, the primary function of the vessel and those on board is to save life. The people on offshore installations rely on your attitude and ability to perform. The better prepared you are, the better you will be able to cope with any emergencies and less likely to panic. With the proper attitude, training on board can be enjoyable. Persistent moaners bring others down. Highlight the positives, work on the negatives, and encourage open and frank discussion amongst the crew.
The master is in overall charge because every team needs a leader. But there are so many tasks that the ship has to fulfill, there may be times when he needs you to do a little more. It'll depend on individual circumstances, the group involved, and even individual skills. But be prepared to accept a greater level of responsibility.
A team that functions well is usually made up of a variety of skills and attributes. Everyone has something to contribute, whether it's doing the job, planning the job, or looking at better ways to do it. Contribute what you can to the team.
So Chef, there's 10 of us in the film crew. We've got 4 vegetarians, 1 vegan, and I'm lactose intolerant. If you just do us a simple 3 courses, maybe finish with coffee and cheese?
Yeah, you're a comedian or something? You can do it yourself, my friend.
Well, a bit short notice, admittedly, but... Right.
In a similar way, you cannot expect the AMA to be the saviour of all. Let's face it, he's got a hell of a job to do, and you can't leave him to deal with every casualty by himself. With your help, his role can be made so much easier.
We put the bag and mask on when we're using it like that, guys.
If you don't understand anything, then ask your facilitator to explain it further. If they don't know the answer, they should be honest enough to admit it and try and find out more from the training providers ashore.
I should be able to blow air into the dummy.
Work with your facilitator. Be constructive and be positive. A little bit of enthusiasm on your part goes a long way to making his job more rewarding and enjoyable.
Well, what we try to have as our philosophy is that this is an insurance policy that you never really want to cash in on. But the most important element of training is to give them confidence in their own ability to deal with, crises that hopefully will never happen.
Teamwork is extremely important in this industry as a whole, and particularly when you're dealing with rescue and medical care. Teamwork really hinges for everything. At the end of the day, people have to be in charge of what goes on, but the team that works around them is of vital importance both to the individual and to the actual vessel itself.
We understand that personnel on board vessels and personnel in any walks of life don't remain competent in the skills that are given on initial courses. So therefore, the ongoing training maintains their competence, enable for them to perform the skills required, and in relation to the basic medical aid and the whole production is to save life.
Apathy can be a real big problem for the guys, especially when they're away a month at a time doing their ongoing training. But we try to give them, and with this DVD, we're trying to give them varied exercises and elements to do so that they're not going to become bored with one particular subject or feel that, oh, we're doing this again. We're trying to stimulate questioning when they're actually doing it and debate.
People are reassured by your actions much more than by your words. And if you're acting calmly and coolly, then they'll be reassured. But if you're panicky yourself, they won't be, whatever you say.
What we find in UTEC is the attitude of people that come on course, particularly the initial training. They're full of enthusiasm, and this media of continually updating their skills is another method of trying to install training skills, but also the value that the industry places upon them.
The crews on board the vessels should actually value their own abilities, because within the merchant industry they're probably trained to much higher levels, in fact are trained to much higher levels than anyone else, and in having that training available to them, they should be able to put it to good use at any given time, night or day.
Each of us has our own role that we feel comfortable with, but remember, in an emergency, there may be times when you need to take over someone else's role.
Unless there are casualties that require the specialised skills of the AMA, his role will be primarily to guide you, the crew, in the treatment and care of personnel received on board. Make yourself available if required. Use the first aid skills that you have.
Look into your wound as well.
Ask for guidance when necessary. Get an appreciation of what he might need rather than waiting to be asked. It's essential that the AMA can retain an overview of the incident and manage situations accordingly. This can only be achieved if both you and the AMA get together on a regular basis to prepare and practice such situations.
It doesn't hurt sometimes to take a look at yourself just to make sure you're doing the best you can. I mean, are you keeping your training up to date, for example? Or are you just going through the motions? Are you making a contribution? Have a think about that.
Learn about those other tasks that you might feasibly be asked to do. Speak to the guys who normally do it and find out what the best methods and problems are, and how you can help if required. When running exercises, prepare and deploy all of the equipment required. Only then will you encounter the potential difficulties of using it. If training is to be effective, then the exercises must be conducted in a realistic fashion. If deficiencies or weaknesses are identified, concentrate on overcoming them to everyone's satisfaction. When people experience or witness a traumatic event, severe psychological stress can be the result. Some people may become very upset and disturbed and question the world in general and whether they or others could have done more. If this were a friend of yours, you'd listen and give them some help, wouldn't you? Accordingly, your company will offer counselling at any time following an incident. You'll have a difficult job to do, and talking to someone after the event will help in coming to terms with what you might experience.
I was in an incident 2 years ago with a helicopter, and the crew I was with were a new crew. They hadn't been working together very long. We'd only been together about 5 days. And when the incident happened, everything clicked into place because of the training we've had. Everybody worked as a team, I say due to the training, and everything went smooth. Just everyone clicked into what we've been taught.
The night of Piper, just prior to the alarms going off, we were actually sitting watching a video There was the whole crew of us, the captain was on the bridge, chief in his usual station. We were sitting watching a video, and our man overboard alarm went. And I can always remember us saying to each other, imagine giving us a drill at this time of night. And it wasn't until we got up on deck with all our gear on that the captain informed us there had been a fire and explosion on Piper Alpha platform. We got there, we started to rescue people. The Silver Pits boat was rescuing people. We went in, we picked up 4, went to leave. Another 2 came down in the same area. We went back, picked them up, and it was that time we got tangled underneath the platform, just underneath, beside one of the legs. And I can remember looking up, and the whole platform above us was just ablaze. It was just fire everywhere. Once we discovered we were tangled in the debris of Piper, we attempted to cut ourselves free with the knives we had. We were cutting the debris free when the major explosion that you see in video footage went off above us. I never saw the boat again. I never saw a rescue boat. The 6 people we had rescued, all my 2 colleagues, they disappeared. I never saw them. I ended up in the water with fire everywhere. My main concern when I was picked up at the night of Piper was obviously where's my friends, my colleagues. I'd sailed with them for a lot of years. You know, we were very close, small crew, small ship. My main concern was where they were, because I hadn't seen them since the big explosion. Unfortunately, my 2 colleagues both perished that night.
After a major incident like that, it's going to change your life forever. You'll never be the same. You'll always be reminded of it in many strange ways. But I think on reflection, you always sort of look back and think, could I have done this differently? Could I have done that differently? But you have to accept that what happened, happened. You did the best you could in the circumstances you were in, with the equipment, the knowledge, and the help that you had. And by and large, I think that you can come to terms with it usually pretty well afterwards. But I think the important thing is, if you have concerns or worries, then don't bottle it up, but talk to somebody. Make sure that it's out in the open. Talk to people that were there, or talk to people that are trained to talk to you. But I think it is important that you do speak to people about it.
We're here to look after the safety of the people on the platforms. That's why we're here. That's not brave, it's just what we're here for.
There's an awful lot of medical gear on board, but what the hell does it all do? Your job to find out, no excuses. You have to be able to walk in here and find and recognise any item of kit at all. You may not have to use it yourself, but you'll be helping the AMA to do his job.
For his part, a good AMA should hold regular realistic exercises to familiarise the crew with the medical gear and clarify what roles can be helpful to him. This could be preparing some items for future use or simply checking things out. In advance of every trip, you should take stock of equipment and facilities carried on board for potential survivors. Any omissions or out-of-date items should be reordered immediately, while specific servicing schedules for other items should be arranged as required. Your ship carries varying quantities, types and classifications of drugs for survivor use. The majority of these drugs will require authority from a qualified person before they can be administered. As with all drugs, details of their administration should be recorded. For those drugs such as paracetamol or Entonox, it will be sufficient to mark such details on the casualty's cruciform card. For controlled drugs such as buprenorphine, the procedures dictated by the Misuse of Drugs Act require that the vessel operator ensures that appropriate arrangements are in place to satisfy the legal requirements for storage, control and administration. The administration of drugs, in the absence of a medic or doctor, will normally be the responsibility of the AMA. The basic medical aider will therefore be required to witness the procedure. Both parties involved should verify the name of the drug, dose or amount, expiry date, and appearance. There are a considerable number of items held within the medical lockers that are classified as being specialist medical equipment, and as such should only be used or authorised by suitably qualified personnel. Such items would include intubation equipment, intravenous cannula, laryngeal mask airways, intramuscular injections. The automated external defibrillator, or AED, is designed to be used by those equipped with CPR skills, but should only be used by the AMA on board the vessel, provided they have received training on how to use it from qualified instructors ashore. Aside from treating potential survivors during an incident, you could be tasked with using rescue equipment on board the vessel. Once again, participate during realistic controlled exercises. Discover the practices adopted for this vessel in respect to preparing, deploying and storing the equipment, and if in any doubt, ask. Remember, you have been trained to a level where you have basic medical aid skills and should not go beyond those boundaries. Equally, the advanced medical aiders are only expected to use this knowledge to assist any medical professional that might come on board during an incident, or in required instances, act upon qualified medical authority given by radio link.
You'll be watching this DVD because it forms part of your ongoing training on board. While practice may not make perfect, pretty good, eh? It does make you a lot better at what you do, and that's going to make life safer for everyone on board. So practice, practice, practice. Believe it or not even we get it right first time.